Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on Entresto. So Entresto is indicated in adult patients for treatment of symptomatic chronic heart failure with reduced ejection fraction. So what is Entresto? Entresto contains a combination of Sacubitril and Valsartan. Sacubitril is a blood pressure medicine. It works by increasing the levels of certain proteins in the body that can dilate or widen blood vessels. This helps lower blood pressure by reducing sodium levels. Valsartan is an angiotensin II receptor blocker, sometimes called an ARB. Valsartan keeps blood vessels from narrowing, which lowers blood pressure and improves blood flow. Entresto is used in certain people with chronic heart failure. This medicine helps lower the risk of needing to be hospitalized when symptoms get worse and helps lower the risk of death from heart failure. Entresto is also used to treat heart failure in children who are at least 1 year old. Entresto is usually given together with other heart medicines. So some important information on Entresto. So you do not use Entresto if you are pregnant. Stop using this medicine and tell your doctor right away if you become pregnant while taking Entresto. Entresto can cause injury or death to an unborn baby if you take the medicine during your second or third trimester. If you have diabetes, do not use Entresto together with any medicine that contains alicicarin before taking this medicine. So you should not use Entresto if you are allergic to Sacubitril or Valsartan, which is Diovan, or if you have ever had a severe allergic reaction to a blood pressure medicine, such as an ACE inhibitor. So these would be captopril or ramipril or perindopril, or an A or B. They're the receptor blockers. So an example would be the candesartan or atacand or losartan and valsartan and telmisartan, and there's a few others. Your doctor or pharmacist will go through them with you. You should not take Entresto within 36 hours before or after you have taken any ACE inhibitor medicine. You may also need to avoid taking Entresto with alicicarin if you have kidney disease. To make sure Entresto is safe for you, tell your doctor if you have ever had liver disease, diabetes, hereditary angioedema, or if you are on a low salt diet, or if you are dehydrated. Do not use Entresto if you are pregnant. As I said, stop using and tell your doctor right away if you become pregnant. And Entresto can injure or cause death to an unborn baby. So you use effective birth control. It is not known whether Sacubitril and Valsartan passes into breast milk or if it could harm a nursing baby. You should not breastfeed while using Entresto. So how do you take Entresto tablets? You take Entresto tablets exactly as prescribed by your doctor. You follow the directions on your prescription label. Your doctor may occasionally change your dose to make sure you get the best results. Do not take this medicine in larger or smaller amounts or for longer than is recommended. You may take Entresto with or without food. Take the medicine at the same time each day. Sacubitril and Valsartan doses are based on weight in children. Your child's dose needs may change if the child gains or loses weight. Your blood pressure will need to be checked often. Your kidney function may also need to be checked. You store Entresto in the original container at room temperature and away from moisture and heat. So ask your doctor or pharmacist if you have any questions. Entresto dosing information. So the usual adult dose for congestive heart failure, the initial dose is Sacubitril 49 mg and Valsartan 51 mg twice a day. And the maintenance dose is 97 mg and 103 mg twice a day. And it's used to reduce the risk of cardiovascular death and hospitalization for heart failure in patients with chronic class 2 or 4 heart failure and reduced ejection fraction, usually administered in conjunction with other heart failure therapies or in place of an ACE inhibitor or other ARB. So what happens if you miss a dose? You take the missed dose as soon as you remember. You skip the missed dose if it is almost time for your next dose. Do not take extra medicine to make up for an earlier missed dose. So what should you avoid while taking Entresto? Avoid getting up too fast from a sitting or lying position, or you may feel dizzy. Get up slowly and steady yourself to prevent a fall. Do not use potassium supplements or salt substitutes while you are taking Entresto unless your doctor has told you to. Drinking alcohol can further lower your blood pressure and may increase certain side effects of Entresto. So the Entresto side effects: first of all, you get emergency help if you have signs of an allergic reaction to Entresto. And these are hives, difficulty breathing, swelling of the face, lips, tongue or throat. And also call your doctor at once if you have a light-headed feeling, like you might pass out, extreme tiredness, high potassium or slow heart rate, weak pulse, muscle weakness, tingly feeling, or little or no urinating, painful or difficult urinating, swelling in your ankles and short of breath. So common Entresto side effects include dizziness or cough. So this isn't a complete list of side effects. For more, you can talk to your doctor or pharmacist for more on the side effects. So what other drugs will affect Entresto? So first of all, you need to tell your doctor about all the medicines you're currently taking and you start or stop using, especially alisecrin, lithium, any other heart or blood pressure medicines, a diuretic, a medicine or mineral supplements that contain potassium, or non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen and naproxen and diclofenac and indomethacin or Mobic. So that's not a complete list. Other drugs may interact with Sacubitril and Valsartan, including prescription and over-the-counter medicines, vitamins and herbal products. Not all possible interactions have I mentioned here. For more on side effects and interactions, you need to talk to your doctor or pharmacist. So that brings this video to an end. If you have any questions, you can contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.